From CareCredit, it's Care Experts, a podcast where we dive deep into the health and pet care industry with the professionals that make it happen. I'm Antonio Diaz, and this is Logan. This episode is brought to you in partnership with Banfield Pet Hospital, quality veterinary care and pet wellness. Getting older is a part of life, even for our pets. But aging doesn't have to mean slowing down or giving up the things that they love. With the right care, daily routines, and a little extra support, our pets can stay active, engaged, and happy throughout their golden years. Today, we're joined by Dr. Taneeka Bautista, a veterinarian and medical director at Banfield Pet Hospital, to talk about how small, proactive changes can make a major impact on a senior pet's health and happiness. She shares what to expect as pets age, how to support them physically, and simple ways to adjust your home, routine, and mindset to help them thrive. Dr. Bautista, I'm so happy to have you here. I would love to hear more about what got you into veterinary medicine and your journey to where you are now in your life.
Yeah, thanks for asking.
Yeah.
I love being a veterinarian, and I knew that I wanted to become a veterinarian when I was very young. So I grew up with lots of pets, primarily cats in my household. And through having so many cats, I got to see more cats through them having litters. So I got to see a lot of different things that could happen, and including taking them to the veterinarian. So when I was young, we would take our pets to the veterinarian pretty often whenever we needed to. And the great thing is that the veterinarian that was in my neighborhood that we would visit actually let me come into the back of the hospital as well,
Oh, wait, that's
and would
awesome.
show me things. Yeah, so I got to explore and ask questions and really find out more about what was going on in a veterinary hospital, and it helped me to develop the aspiration to become a veterinarian when I was a young girl.
Are you a little biased towards cats versus dogs?
I'm honestly a cat person.
Okay.
Yes, it's okay to say.
Yeah, absolutely. I was just going to tell you, it's totally fine. You can be.
Yeah.
Yeah. I'm a dog person, but I think people would assume that I don't like cats, but that's not true at all. I actually do like cats. I certainly don't feel as comfortable, in terms of like reading them. I've been to clients' homes where I'll like try to pet a cat and then they bite my hand, and I'm like, all right, well, I didn't see that coming. Versus with a dog, I would absolutely have seen that coming. But with cats, it can be a little bit more hard to read for me anyway. So yeah, I can appreciate the honesty though, for sure. Well, let's talk about a subject that can be a little bit difficult sometimes, aging pets. In your experience, do you find that the pet aging process is something that people are becoming more aware of and more prepared for, or is this something that they're having difficulty acknowledging and discussing?
I do think it's something that if someone's bringing their pet to the vet pretty often, those are conversations that are a normal part of a pet visit because it's a part of preventive care and discussion. And so when a pet is coming into the veterinarian every 6 months and having a physical examination and a consultation, the progress of their age and life stage and changes that have already occurred or might be anticipated to occur, it is a part of the discussion. If they don't go to the vet very often, then that might not be something that they're anticipating, and so it's really helpful when pets are seen frequently, and then that can be something to prepare for.
Okay. How would you categorize like the age benchmarks for pets? As an example, I'm, from what I understand, about 8 years old for a dog is when they're considered a senior. Do you agree with that?
Yes, I do agree with that. As dogs get older, there are different life stages from puppyhood, young adult, older adult, and then what we would consider to be a senior. And commonly that's 8 years and above. Okay. It can also depend on the pet's size and their breed too. So smaller dogs, for example, can be a senior when they're, anywhere from 8 to 11 years old. Okay. While giant breed dogs, for example, Great Dane, they might be considered to be a senior at a younger age, around 6 or 7 years old.
Wow. And that's specifically due to their size?
That's a big part of it, yes.
Okay.
Just the age and the progression of their size. Sometimes there are some age-related changes that occur more quickly in a dog that's bigger.
Yeah. What's the oldest dog that you've ever had in your practice?
Wow, I've seen definitely dogs that are in their upper teens.
Okay.
And so that's really nice to see.
Yeah.
16, 17, 18, for medium sized to large breed dogs. And then for younger dogs, even so, some dogs can definitely live, to their upper teens as well.
Yeah, I think that's definitely a goal for most dog owners. I know for me with my
Yeah.
Shepherd, I was really hoping to get 16 years out of her, but she left us at 12. So, but I know it's such a difficult thing to discuss. Do you find that people shy away from that conversation when you start talking about, certain aspects of the end of age process? Or are they more willing to have those conversations in preparation for that?
Well, I think it depends on where the conversation's originating from. If it's more so a preparation of ways, here's how you can prepare for your
Hmm.
pet as they're becoming a senior, and to make sure that they're comfortable and that we're decreasing progression of a condition or catching things early. That's a little different from once those things start to occur, and depending on how much it's affecting the pet as well. I do think it's a responsibility for us to make sure that we're advocating for the pet's quality of life at home. And so that is an important conversation to have.
Okay. Let's talk about some aging myths. Um, I have heard a ton of things. One of them being you can't teach an old dog new tricks, which I completely disagree with. I have my own way of describing that, but I love for you to debunk some of those aging myths if you have any.
I'm glad you disagree with that, because I do think that it's situational. It's pet to pet, their environment, their where who their pet owner is,
Hmm.
and how much really is involved in teaching them new tricks.
Yeah.
So, and the reason that I also really am passionate about that is because sometimes people might be considering adopting an older pet or a senior pet, and that might be one of the reasons that they hesitate. And it's absolutely possible to help older pets to become a part of our home, and to live with us and to learn new tricks,
Yeah.
as far as being a part of that household. So I definitely think it's a possibility. How much that occurs, and the new tricks that we're trying to teach them, that all of those variables can
Yep.
play a big part in the outcome, but I do believe it is possible.
Yeah, I agree. So what I tell my clients is that would you ever say that your grandparents couldn't learn how to use a computer, right? Or use a phone? I like to kind of gauge it on, I would say, if we're asking our senior dog who has bad hips to do jumps and we're going to teach them to jump through a hoop, that might be more difficult or not necessarily appropriate for them. But to change behavior or to teach them how to respond differently to certain stimuli, that's a completely different conversation. As long as they're cognitively aware of what's going on, then it shouldn't be an issue. And they absolutely have the ability to learn. And I usually equate that to motivation. So if the dog is motivated to learn, for example, that your senior dog loves, certain treats, then you can absolutely use that to teach them new things. And it's a lot like us, where we might be very intelligent, but if we're not motivated to learn new information, then we're not going to. But if we're motivated, then we can utilize our intelligence to learn those new things.
Yeah, absolutely. That's the will versus skill.
Exactly. I love that. So, if there are things that a senior pet can do really well, do you think people should emphasize that in their daily routines and lifestyles with their pets? Or should they, let's say, keep it really lighthearted and not engage very much with their senior pets?
So for senior pets, sometimes they want to do the things that they've always done. And I think that's okay, as long as we're being careful with considering how much intensity is going into that.
Good
So
point.
if pets love to go for walks, maybe we're not going to have the same pace in that walk,
Mm.
or the length of the walk. We're going from maybe walking miles to maybe walking around the block,
Yeah.
right? And so those modifications can occur as a pet's age increases. If it's really something that the pet loves to do, I think it's important to still let them do those things, just in a more cautious way.
Yeah. Lower the intensity. I love that. Do you notice a shift in nutrition or water intake when it comes to senior pets? Do things change? Do they need different foods or a different way to approach their health?
There's not really a specific diet recommendation for senior pets. However, as a pet ages, sometimes they can develop there's a reason that a veterinarian may recommend a different diet for them. So if there is a significant increase or decrease of water intake or food or sleeping habits or other behaviors, those could be part of normal aging, and it's okay in that case because aging does occur and it's normal. However, it could also potentially be something else. And I really rely on the pet owner to be an expert on the things that they are seeing in the house and to be able to tell the veterinarian what that is, so the veterinarian can look further into the medical considerations for what could also create that behavior change
Yeah.
that the owner is experiencing. Sometimes it is a medical concern.
Yeah, and that's something we talk a lot about on this show is learning how to observe your pets and really paying attention. I think that oftentimes people aren't really paying attention. So by the time they notice a significant difference or a difference, it's so significant that it could have been avoided or addressed early on. So I think learning to observe and, like you said, becoming an expert is really, really important. And I think that type of information and way of living and looking at our pets is becoming more known nowadays, where people are becoming more involved in their health, in their nutrition, and trying to take the right steps to have a better lifestyle and provide better health care for their dogs and cats for that matter.
Yeah. And I am so glad that that's the case.
Agreed.
You know, people are learning how to be more proactive with their pets' health care and their entire lives.
Are there any environmental changes that can occur in pets that make them feel more secure or help them become a little bit more mobile?
Yes. So, something that is common as pets age, both dogs and cats can develop, for example, arthritis.
Okay.
That is very common. And so, having the ability to give them the most comfortable environment possible is really helpful. It decreases discomfort, potential injury, and can help them to rest well. So, having, for example, a ramp in the house if needed to allow the pet to get up on the furniture, having ramps or steps that are made for pets specifically to be able to go on and off of surfaces from one height to the next decreases the likelihood of them jumping and potentially injuring themselves, either jumping up or jumping down. Also, as pets get older, their ability to move around decreases. It can their mobility can be impacted, and gripping the surface of the floor can be a challenge sometimes, especially if it's slippery flooring. So having a rubber based type of flooring mat or a yoga mat, for example, or carpet, is really helpful to allow them to really get around comfortably and less slipping and potentially falling as
That's
well.
a good point. I know with like ceramic tile or even hardwood floors, dogs can slip a lot. Would you go so far as to say that even maybe booties in the house to prevent an elderly dog from slipping and sliding a lot to prevent injury? Would that be a good idea?
That may help if your pet tolerates booties.
Fair enough.
Yes.
Now, if a dog is not that mobile, what are some tips and recommendations you have for mental stimulation to keep pets active mentally? Because we know that's a big part of their overall health and fulfillment of life.
Right. So, yeah, mental health is very important. Sometimes there can be cognitive decline that can occur for pets. So, by stimulating them, by being with them, sometimes I think that as pets get older, they get left alone a little bit more,
I can see that. Yeah.
And that doesn't necessarily need to be the case. They can still participate in a lot of things that we do. And whether that's in the house or outside of the house, even traveling, things like that. So if you can get your pet involved, that's great. If not, then having toys and things that are going to keep them active in the house is also really helpful. It gives them something to do if they are alone. If they do develop signs of anxiety, which can be pacing or vocalizing or, maybe destroying something in the house, then we do look for ways to decrease that from happening by also bringing them to the vet, get a consultation, talk through what those circumstances are. Sometimes there are also medications that can help to decrease anxiety as well.
Okay. What are some signs that if a person saw with their pet that are like a guaranteed reason to bring them to the vet and to come and see you?
So I would say changes in eating, drinking, sleeping patterns.
Okay.
So increased appetite. Sometimes you can tell if your pet's just asking for a snack or if they have a more voracious appetite and they really, really want to eat more.
Yeah.
Or similarly, drinking more, just drinking, emptying the entire bowl of water and wanting more. Those can be signs of something that could be wrong. Alternatively, not eating and
Yep.
not drinking could also be a sign of something wrong. Also, sleeping more often or being restless and uncomfortable too. So, a lot of those things can be a sign of something kind of creeping up. It could, usually, pets are, they don't necessarily show their symptoms outwardly as much. And so, we have to be very observant, but some of those symptoms can be pretty obvious. Um, Getting sick, vomiting, diarrhea, breathing heavily, labored breathing is a concern, potentially lameness, seizures, things like that. That should all be a sign to definitely go into the veterinarian.
Gotcha. So, are there certain questions that people should be asking when they're bringing their dog in for a yearly exam, as far as like the aging process and what they can do to prepare for it?
Yeah, I think that the way that you phrase it is a great way to ask,
Okay.
how's my pet doing? What life stage is my pet in? Or that can be also, kind of informed to the pet owner by the veterinarian so they are aware.
Yep.
And what can I do to prepare for my pet's age, progression as well?
Okay.
Whether that's in the environment, whether that's something that we could do to make sure that they're just more comfortable at home, or what to watch for and to monitor, and how to decrease the chance of things that are preventable from occurring.
Okay. And are there any diagnostic tests that people should be requesting?
Yes, actually, most of the time when a pet comes in for an examination and as a senior pet, there are even more robust diagnostic tests that we recommend.
Okay.
So it is recommended to see the veterinarian every 6 months. And the reason behind that is that pets age more quickly than people do.
Yep.
And sometimes even just the physical examination can be different, and we can catch things that have changed from that baseline or previous, visits or 6 months prior visit. So the physical exam is a big part of it. And then additionally, diagnostic tests go along with that. And that can include a full blood profile,
Okay.
checking their organ function, checking their blood cell count, checking their kidneys, their heart as well, looking for any changes in the values of those that could be trending one direction or another, could be an indication of a concern. Sometimes we're also checking their thyroid and their kidney function through an SDMA test. We do electrocardiograms on pets that are older. Radiographs as well, whether that's a screen and again to check on progression of a concern that they already have, or to also just to evaluate how things are, from a radiograph perspective as well. So there's a lot of diagnostics that we do recommend for senior pets.
With overweight pets, do you find that they have a more difficult time in the aging process?
Yes.
Yeah.
The weight, a pet's weight has a very important correlation to their mobility.
Okay.
Absolutely. So when a pet is more overweight, they are more likely to develop arthritis as well. And unfortunately, it can be more severe. So when they lose weight, that actually is part of their therapy.
Okay. And do you think diet changes? Well, let me ask it this way. If you have a client with a pet that's overweight and aging, do you put a strong emphasis on trying to bring that weight down? And do you find, if so, do you find a lot of hesitation with that, with the client following through? I would imagine, and I ask that question because I know that how much people love their animals. So sometimes food is love, so they have a hard time saying no. But I was just curious to see, from your perspective, is it difficult to try to convince people and help them see the bigger picture of the overall health issues that are being created by overfeeding them?
Yes, it's definitely part of the recommendation
Okay.
to lose weight. And sometimes people are motivated to do that, but it's easier said than done.
Yeah.
and it needs to include everyone in the household participating in that. It can't just be one
Absolutely.
person. Our pets know who to go to if they are requesting a snack.
Yep.
So it's everyone involved, and you're right. Sometimes people love their pet with food. Food is a motivator for pets, and so it becomes a motivator for us to feel
Yeah.
like we're doing something and it's loving. At the same time, though, it could be doing the opposite of what we want as
Yep.
far as keeping them as healthy as possible. So that's what we just need to be careful with.
Yeah. I know it's hard, but I tell people all the time, think of the bigger picture. Think about the potential years you're taking off their life, or even still, like the difficulty you'll have in your heart watching your dog struggle to get up because they're overweight. So
Agree.
how do Banfield's wellness plans, virtual calls, and their senior hub play a role in helping owners be more prepared for their dogs in the aging process?
Yeah, we actually have senior care wellness plans.
That's awesome.
Yeah, it is awesome because it gives most of those things that I just mentioned, those are included in those optimal wellness plans
Okay.
for senior pets. So all of those diagnostics that are recommended for senior pets, the urine, the blood work, the heart testing, the kidney testing, the entire organ function, radiographs with a consultation with a board certified radiologist. So there's another set of eyes on the radiographs
Love
as
that.
well. And all of those diagnostics are included. Plus, it has unlimited office visits.
Okay.
So if someone does have a concern, they can come in as soon as possible and don't have to kind of watch and see, is it going to change? And, they have the ability to bring their pet right in. Additionally, there are ways to have virtual visits on that wellness plan as well. So sometimes the visit doesn't require you to actually get in the car and put your pet into the car and to come in. We can actually do that virtually, which is really nice for senior pets to not have to
Yeah.
get up and come into the hospital. And it also includes the pet chat, which is a chat on the phone. So it's through our Banfield app, and pet owners can go onto the Banfield app and chat a question, especially when the hospital is closed.
Okay.
They can text a question to a veterinary professional and get an answer in the moment. It's like having a vet in your pocket.
And is that 24 hours?
That is 24 hours.
Wow,
Yes.
that's pretty cool. I know a lot of people who would love to have that for sure. Do you have any tips on anyone who is struggling between caring for a senior pet and a younger dog, or a younger pet in the house at the same time?
I think it depends on what their relationship is.
Okay.
Were
Yeah.
they introduced to each other long time ago? They've spent some time, they know each other well, or is this a new relationship?
Yeah.
A younger pet is going to probably have more energy and want to do more things, and sometimes the older pet maybe doesn't want to do those things. And so just making sure that they're both safe in their environment. They might need to have separate areas, or if they can be together and play together, that's great too. So kind of supervising that to see how they get along. Also, sometimes one pet is eating one type of diet, the other pet's eating the other type of diet. So just being really aware of those kind of differences that might exist between the two of them. But it's great when older pets and younger pets, when they have companionship and then they can spend time together. We just want to make sure that that occurs safely.
Yeah, I agree. I often tell my clients to learn how to nurture their relationship, one, and then another way I like to tell them how to handle it is advocate for the one that needs it. In my line of work, I deal a lot with dogs. So if we have a young puppy with a ton of energy and an older senior dog that's not really feeling that energy, we want to make a point to advocate for that dog and not necessarily get upset with the older dog for trying to set boundaries. And I see that happen a lot, because people think, oh, he's growling at the younger puppy and that's bad. But the reality is that they're just trying to create space and set a boundary. And I often like to give the example, being from Las Vegas, locals will definitely understand this analogy. But when you're around the Strip and you've got a lot of young college kids that are just full of energy and been drinking, and you're a local, you're just kind of like, all right, man, I don't want all that craziness around me. I'm just trying to have dinner, with some friends. So that's kind of how I look at it. Like, you don't want somebody that's constantly in your face trying to provoke you to have an energy level that you just don't have. So it's very important to be mindful of that and advocate for each dog in the house or pet in the house. So I'm excited to jump into our Ask Me Anything portion of the show. We have some questions lined up that our viewers and listeners would love to hear from you. So let's jump in. My dog Mango just turned 8 and seems totally fine. He's not slowing down at all. Should I still switch him to a senior diet?
So if Mango seems to be the same as always, I think it's okay for Mango to continue to eat whatever is being fed right now as far as the pet food goes, and have a consultation with the veterinarian, because there may be additional recommendations, supplementation, things like that can be considered.
Okay.
And also, depending on how that examination and full profile goes, then there might be some, maybe a change in the diet recommended at that time.
Okay. So even though a dog is at the senior age, we don't necessarily have to, we'll say, treat them as a senior. We're still going to look for some signs that we need to now have that discussion or make those adjustments.
Right.
Okay. All right, next question. My older dog, Gunner, isn't interested in toys anymore. How else can I keep him stimulated?
Oh, well, so if Gunner's not interested in toys anymore, I would wonder more about like what kind of toys are being used. Maybe there's a different option that Gunner can, that we can try in the house with Gunner. Yeah. In addition to that, though, spending time together, maybe there is more ways to spend time outside, go for walks. Low intensity things. We don't want to cause any injury, but we can find other ways to stimulate Gunner besides having that type of toy that has been used before, just to explore more options.
Okay. So next question we have. My dog Lily is 10. She's a Maltipoo and loves hiking, but seems to be slowing down and getting tired earlier than usual. Is there a sign that it might be too much exercise for her, and when I should scale back as she ages?
Yes, I think that is the sign. If she's starting to slow down, let's watch for that and notice when those kind of changes occur. It's normal for pets to slow down as they age, just like it is for people. And so if that's the case, having that drive to keep doing the things that are maybe a little bit too intense, that's not the recommendation. And instead, let's kind of slow down our pace so that we're meeting her where she is. And then, of course, try and find out more about what might be causing her to slow down. Is it just her age, or is there something else going on? So by having an evaluation with the veterinarian, that can really help as well.
Perfect. All right, last question. How often should I bring my senior dog to the vet for a checkup? Is it still once a year, or do I need to go more often? And can I do a virtual vet visit for just this?
So it is recommended more than once a year. Yes. Actually, twice a year.
Okay.
Every 6 months is the recommended proactive preventive care visits. Those are comprehensive examinations that occur.
Okay.
And it's a nose to tail visit. We're looking in your pet's mouth. We're looking in their eyes, their ears, looking at their skin and coat as well, checking their mobility, their joints and their muscles, also feeling their abdomen. So, and listening to their heart and lungs, of course. So all of those things can occur in that every 6 month visit, and pets do age more quickly than people. So sometimes there can be changes that are identified in that 6 month visit too.
Gotcha. So for those visits, a virtual call or a virtual visit really wouldn't be recommended, because you wouldn't be able to get the full scope of the dog's condition.
Correct. Gotcha. This is a visit in the hospital. We usually use the virtual visits for follow-up visits.
I see. Okay, perfect. Well, thank you so much for all of your valuable information. Such a pleasure to have you on the show.
Yes, thank you so much. It's my pleasure as well.
Thanks again to Dr. Bautista for joining us on Care Experts. We learned so much about caring for our pets as they age. We appreciate all of your expert insights. Thanks to everyone tuning in. This episode was brought to you in partnership with Banfield Pet Hospital.
Through November 30th, 2025, earn an entry for a chance to win $5,000 in the CareCredit Let's Get Digital sweepstakes. Enter the secret word PET in the sweepstakes hub to earn one entry now. Head over to the sweepstakes hub by simply visiting carecredit.com/Let's Get Digital. No purchase necessary. A purchase will not increase your chances of winning. Legal residents of the 50 United States, D.C., and U.S. territories 18 years of age or older who have a CareCredit credit card as of 9/2/2025. Void where prohibited. Promotion starts 10/8/2025 and ends 11/30/2025. Grand prize and weekly prizes are awarded in the form of a check. For official rules, including odds, free method of entry, and prize descriptions, visit carecredit.com/Let's Get Digital. Sponsor Synchrony Bank, 170 Election Road, Draper, Utah, 84020.
Whoa, whoa, whoa. Don't leave yet. I just want to say, if you want to hear more about health and pet care, check out these episodes of Care Experts. Also, before you go, make sure you hit that like and subscribe button. New episodes drop every Wednesday. You don't want to miss it.